Hello, everyone. Good evening. Welcome to our Facebook Live this Thursday. So, again, we are going to have a nice session tonight. We have prepared great questions for you on nursing prioritization and delegation. Hopefully, everybody can hear me, and I know that most of you are in the comment section now. So, now let's start the session that we have. Okay. So, before everything else, again, I would like to introduce myself. My name is Mr. Alan Matus, and I'm a nurse educator. I have been helping students for more than 25 years past their NCLEX, and also I'm a faculty of a nursing program at this time. Okay, so I help also students pass their nursing licensure and also the nursing program. And if you don't know, also I am an author of a book that I published in Amazon, and the title of the book is The Simple, Fast, and Easy NCLEX Review. So you can purchase the book in Amazon, and it's also now available in the Philippines. You can email Matus Nursing Review academy@gmail.com to get a black and white copy of the book. Okay, so if everybody has the book, or if someone in the comment section has the book, can you please make a shout out if you like the book or not? So until this time, most of these ratings that we have are 5-star ratings, everyone. Okay, so hopefully this book can help you review for your NCLEX, especially if your goal is to review the nursing content to master the nursing content. Okay. All right. So I think Vibrant Diane Rose has a very nice comment in the comment section. She says that there are so many good review materials and nursing review online out there, but we really have to find what fits us, like how we are able to understand the lessons very well. So thank you very much, Vibrant, for your comment about the book. Okay. So what is our agenda for tonight, everyone? Okay, or what's our agenda for tonight? So before we start, we always have the motivational photo or the testimonial for tonight. So our motivational photo comes from Vibrant, okay, and or Diane. She actually sent this photo today. Um, she's very happy to receive the workbook, so we're sharing it in the session for tonight. So she says in the message, it makes me more excited to finish this and more determined to ace the NCLEX on my next attempt. Thank you for telling us that NCLEX doesn't define us, how we're going to be nurses in the future. Thank you. Really appreciate your lectures. Thank you very much, Diane, for your very nice comment. Okay. Especially with the workbook that you have received in the mail. We usually include inspirational messages and also special messages from me that I write to the student, and also hopefully that you like the workbook. It's around 400 pages, and that's something that you can use to for your NCLEX review. Okay, all right. Okay, all right. So thank you very much, Diane, for that. Okay, so now I would just like to make a quick announcement, everyone, about our next NCLEX review program, the live webinar. It's going to be on July 24 to September 25, 2021 from 8 to 4 p.m. It's a Saturday class, 10-day live comprehensive NCLEX review webinar. This program is for new or long-time nursing graduates who wish to review their nursing content. So the goal of this program is really to refresh your nursing content. So we still have, we also receive inquiries of nurses asking for a live classroom. So we're not very sure in July 24 if we're going to have a live classroom. So at this time, I know that we are done with the pandemic already. However, we still have the live webinar for sure. And then if we have the live classroom in July 24, we will make an announcement. So we're trying our best and finding out if we can have a live classroom, because I know some students, they like the face-to-face as well. But if in case, July 24 is the live webinar session that we have, the next session. Okay? All right. So next, we have, of course, for tonight, our free 90-day online access NCLEX review. So stay put or stay after the program because we'll be announcing the winner of our free 90-day online access review. So stay, okay, and we will announce the winner after this, okay? All right. And we have had a lot of students who already passed the NCLEX, because of this 90-day online access NCLEX review that we provide for free to the students every week. All right. So of course, before anything else, I would like to request everyone, okay, if you can share this session with other students. And also, if you're watching in YouTube, please click like or subscribe so that you can get more videos. So we would like to help other nurses, and also it helps my channel, of course, in the algorithm. So please click subscribe, everybody. Okay? All right. And then also, I would like to welcome some people in the comment section. Okay? All right, so Diane is making very nice comments. And then also we can see that somebody who just came in is Aida. Hi, Aida. How are you doing? One of my students. Thank you, Aida, for being here tonight. Angel Cristo. The very first people who came in tonight are the following. We have Gian Torres, Emma, Gemma, Esteban is also watching, Carrie, Camille, Pangilinan, Joyce, Galina, Dayan, Nadia Omar, Fresel, Noel Burgos, Galina again, Mayo. So hopefully we have more students coming in. Okay. So thank you very much, guys. So our topic for tonight, I was asking earlier, it starts with letter N. So letter N is going to be our nervous system for tonight. So let's start the topic. Okay. Nervous system or neurological system. So we will have priority questions and then also delegation questions. Okay. All right. So if you happen not to see this session tonight, we also post some of these sessions in YouTube. So let's have the first question, everybody. Okay, so first question will be on prioritization. Okay, all right. Okay, so I'm going to read the question. Okay, let's see. The nurse is assigned 4 clients in the neurologic rehabilitation unit. Which client needs immediate attention? A. The 34-year-old client who has dysphagia during feeding secondary to an ischemic stroke. B. The 45-year-old client with Guillain-Barré syndrome who has flaccid paralysis and a pulse oximetry of 90%. C. The 56-year-old client with advanced Huntington's disease who claims seeing spiders on the bed sheets. Or letter D, the 42-year-old paraplegic client who has bladder distension due to a blocked indwelling catheter. Again, the nurse is assigned 4 clients in the neurologic rehabilitation unit. Which client needs immediate attention? A. The 34-year-old client who has dysphagia during feeding secondary to an ischemic stroke. B. The 45-year-old client with Guillain-Barré syndrome who has flaccid paralysis and a pulse oximetry of 90%. C. The 56-year-old client with advanced Huntington's disease who claims seeing spiders on the bed sheets. Or letter D. The 42-year-old paraplegic client who has a bladder distension due to a blocked indwelling catheter. Okay. So who do you think is going to be a priority among these 4 patients? I know that we have 4 situations that are considered to be urgent in this situation, but what do you think is the most life-threatening situation here or issue for your patient? All right? And also, we would like to welcome some people who mentions their location. Can you mention your location also, everyone? So for location, we have the following people. So from Doha, Qatar, okay. So we also have from Maryland, okay. Okay, let's see. All right, so let's see. Okay, if you can mention your location, guys. Are you from California? So Gian is from California. Okay, from Nepal is Shrestha. Okay. Then also we have, okay, all right. So Halimat said she got the book. Yes, from Amazon. Very interesting. Olayinka said, best review book ever. Thank you. Okay. All right. Okay, so let's see what's the answer to this question. Okay, so Diane is from Oregon, and Garcia Lay is from Austin. Grace is from Philippines, and Joyce Flores is from Saudi Arabia. Okay, so what do you think is the answer to this question? Are you ready, everyone? Let's see what's the answer to that question. Okay, so let's have the answer is going to be, I know that you have different answers in the comment section. Okay, so the answer number one, okay, is going to be letter B, everybody. Letter B. The 45-year-old client with Guillain-Barré syndrome who has flaccid paralysis and a pulse oximetry of 90%. Now, we all know that Guillain-Barré syndrome is a neurologic condition that is characterized by the inflammation of the nerve, peripheral nerves, and damage to the myelin sheath that leads to flaccid paralysis. And usually, this could also be triggered by a viral infection or a flu vaccination, for example. And the most outstanding manifestation of Guillain-Barré syndrome is your ascending paralysis. So it starts with numbness and tingling in the lower extremity, and then you have your ascending paralysis up to such time wherein the patient may have respiratory complications. Okay? The most outstanding type of manifestation would be flaccid paralysis, and also, of course, you have pulse oximetry here, which is 90%. So that's the reason why letter B is the answer, because the pulse oximetry is 90%, which is more of circulation and oxygenation. So that's why it is a priority. So that comes first, oxygenation as a priority. I know that you have other conditions that are also priorities. However, always remember airway, breathing, and circulation. So oxygenation comes first. The normal pulse oximeter reading is 95 to 100%. So anything that is below 95 could be a concern for your healthy patient or for your patient here, which is your Guillain-Barré syndrome. Okay? So that's why letter B is the answer, everyone. And I know that you also have other conditions that are priorities here, but B comes first. Okay? Now, why is letter A not the answer? I know that we have dysphagia, patient will be prone to aspiration. It needs attention. However, it's not as life-threatening right now compared to your letter B. Your letter C, advanced Huntington's disease, seeing spiders. Remember that Huntington's disease is characterized in the advanced stages with hallucinations and delusions. So it's normal to see hallucinations for patients with advanced Huntington's disease, although that could be also a concern because we want to make sure the patient is safe, okay, while having hallucination, right? So that's also a priority. We need to address that, making your patient will be safe, okay? Now, letter D, bladder distension is also a priority, okay? Especially with a blocked indwelling catheter for someone with a spinal cord injury. So you will see A, C, and D are unstable patients as well. However, you always have to choose the situation or the client that has more urgent need. So that's why your letter B is the answer, everyone. Okay? So hopefully everybody you get the right answer. So B, all right? So that is going to come first. Okay? So let's have the next question, everyone. Okay. So number 2, all right? The nurse starts the morning shift with walking rounds in the neurological unit. Which client should be assessed first? Rank in order of priority. 1. The 65-year-old client with Parkinson's disease who did not have a bowel movement for 2 days. 2. The 24-year-old client who requires application of a facial sling due to Bell's palsy. Number 3, the 39-year-old client with multiple sclerosis who develops hand tremors when using the colite. 4, the 52-year-old client with trigeminal neuralgia who needs carbamazepine due to severe throbbing facial pain. Okay, so I will read the question again, everyone. The nurse starts the morning shift with walking rounds in the neurological unit. Which client should be assessed first? Rank in order of priority. Okay? Rank in order of priority. So number one, the 65-year-old client with Parkinson's disease who did not have a bowel movement for 2 days. Two, the 24-year-old client who requires application of a facial sling due to Bell's palsy. Three, the 39-year-old client with multiple sclerosis who develops hand tremors when using the call light. Or number four, the 52-year-old client with trigeminal neuralgia who needs carbamazepine due to severe throbbing facial pain. What do you think is going to be the order, everyone? This is ranking in order. Remember that. You have to rank in order. So you will have four answers in this situation. Who comes first? Okay. Who comes first, second, third, and fourth? So we have the answer from Emma already. So find out what will be your answer also. Okay. So Diane said, love your messages, sir. So touch, I love the bookmark. Okay. All right. Okay. We need to prioritize airway first. Yes, that was the rationale for the prior question. You need to prioritize airway, breathing, and circulation, especially your oxygenation. Okay. So who do you think comes first? It's going to be second. It's going to be third and fourth in this situation. Okay. Who is the first one that we need to address first? All right. What do you think is the answer, everyone? Okay. Noel also has the answer. Dayan also has the answer. Ivy Nicholas has the answer. Okay. All right. And we'll have the rationale after this. Okay. This is actually a little bit of a difficult question. Okay. I will tell you that. It's a difficult question. All right. But I will give you the rationale after this. Okay. All right. Let's see what's going to be the answer in this situation. Okay. So let's check the answer, everyone. Okay. So put your final answers now. Okay. So what will be the answer to this question? Okay. Yes, it's a hard question, but the answer is going to be 4, 1, 2, 3. Okay, so most of you got number 4, which is really very good. Okay, most of you got the correct answer. 4, 1, 2, 3, 4. Okay, 4 comes first because this is a client with trigeminal neuralgia who needs carbamazepine due to severe throbbing facial pain. So remember that trigeminal neuralgia or tic-douloureux is a condition that is characterized by severe facial pain, even with slight stimulation. And usually the medication that works for trigeminal neuralgia will be your anticonvulsants, not usually opioids, because opioids are not effective for neuropathic pain. So for your trigeminal neuralgia, we have carbamazepine. The brand name is Pepitol. So number 4 comes first. Then you have to assess number 1. Why? Because Parkinson's disease patients are at risk for constipation. And not having a bowel movement for 2 days, we need to check first what's going on with the patient. We need to check the bowel sounds or find out if the patient is okay, right? Then you have your number 2, facial sling. A facial sling is usually needed for Bell's palsy patients because they have facial drooping. But that is not something as important as number 1. Okay, so number 1 comes first, then number 2, and then last is your multiple sclerosis patient. You have to remember that patients with multiple sclerosis are characterized by intentional tremors. Intentional tremors are tremors that happens when they attempt to do something, okay, like using the call light. So that is kind of like expected from patients of multiple sclerosis to have hand tremors when using the Pauline. Okay? All right? So the answer is 4, 1, 2, 3, everyone. So I hope that you learned something in that situation. Okay? All right. Okay, so the lights are on again. Okay, so that's the answer, everyone. 4, 1, 2, 3. Okay, so hopefully you got the answer right. So I think that Noel Burgos got the right answer. I think Emma also got the right answer. So congratulations. Okay, but that was a little bit of a difficult question, especially ranking priorities. That's usually hard in the NCLEX. Okay, now let's go to your third question for tonight. Okay, we have your delegation question. Okay, so I will read the question, everybody. Okay, this is going to be delegation to a licensed practical nurse. Which client is most appropriate to assign to the licensed practical nurse while supervised by the registered nurse or RN? Select all that apply. A, the 43-year-old client who returned to the unit after a cerebral angiogram procedure. B, the 25-year-old client who asked for information after a new diagnosis of amyotrophic lateral sclerosis or ALS. C, the 59-year-old client with myasthenia gravis who needs oral administration of pyridostigmine. D, the 22-year-old client with cervical spinal cord injury who needs tracheostomy suctioning due to copious secretions. Or E, the 32-year-old client with epilepsy who needs to be assessed after a 5-minute seizure episode. Okay? All right, so always remember that every clinical situation is different. So the questions that we're giving you tonight are just guides, for answering questions in the NCLEX. But always remember that in the actual practice of nursing, you have to use your critical thinking because there will always be different situations. Okay, and that's what we're training here for tonight, to develop your critical thinking, but not to memorize answers. Okay, these are only practice questions, everyone. So what are the two tasks that you can delegate to the LPN? Who are the patients that you can delegate here? Okay, and what principles are you using and what rationale do you have? Why did you answer the choices, A, B, C, or D? Okay, all right. So the answer is going to be letter. We'll find out. Okay. So put your final answers, everyone. We are about to reveal the final answer. Okay, the answers to this question. And I hope that you learned something for tonight. You will not learn everything in one sitting. I encourage you to watch our sessions so that you will get a glimpse or change the way you think in answering these types of questions. Okay? All right, everyone. So we're about to reveal the answer to this question. All right. So the answer is going to be letter C and letter D. Very good, everyone. Okay. All right. So the answer is going to be letter C and D. Why? Always remember that your oral administration of pyridostigmine is under the scope of practice of an LPN. And also your letter D, tracheostomy suctioning, is under the scope of practice. Am I right? Okay, so we have Mayo Sarmento giving us a lot of rationale here. Thank you very much for your participation. Okay, Punke said it is for RN. That's correct. Okay, not A, because just came back from angio. Very good rationale. Shrestha said that oral medication and suctioning is within the LPN scope. Very good. Okay, not E, assessment is for RN. Very good rationale, everyone. Okay, ABE is for RN. So Joyce mentioned that. Very good. Because your letter C and D are stable patients, right? There's no clinical situation in letter C that makes them unstable. Okay? Now, as I've said, your letter C and D are stable patients. If your letter C is a patient having a crisis, then you cannot really answer that, because letter C could be unstable. But this time it is stable C and D. A is unstable patient because that's a patient who just had an invasive procedure, which is your cerebral angiogram, which involves the administration of a dye. Okay, so this patient could be sedated and at the same time needs to be monitored for any allergic reactions to the dye and also for any possibility of bleeding because of the administration of the dye into the insertion sites. Now, your letter B is also unstable, not really unstable patient, but that's not something we delegate to the LPN because who asks for information means that would be teaching. So teaching, especially with new diagnosis and full information, that would be for the RN. Okay. Now, letter E is also for the RN because assessment after a seizure episode to document the time, the duration of the seizure, and the characteristic of the aura, that would be also your RN, especially if it's going to be a comprehensive assessment. Okay, comprehensive assessment. So that would be your letter A, B, and E are for RN, and letter C and D is going to be for LPN. And we also know that RNs do not delegate EAT, evaluation, assessment, and also your teaching. We always learn that over here. So congratulations for those who got the right answer, everyone. Okay? All right. Now, last question for tonight, everyone. Okay? It's going to be delegation as well. And I think you're doing very well with your delegation, everyone. Okay. Let me read the question, everyone. Right? The registered nurse is teamed with unlicensed assisted personnel and licensed practical nurse to care for a client who is placed on ventilator due to a hemorrhagic stroke. Which task can be delegated to the UAP? Select all that apply. A. Raise the sidewalls as ordered. B. Remove the indwelling catheter. C. Perform a digital fecal impaction. D. Turn the client every 2 hours. E. Check the skin on the sacral area every shift. Or letter F. Adjust the oxygen flow rate. So which task can be delegated to the UAP in this question, everyone? Okay? So always remember that for the UAP, you have to delegate tasks that are within the scope of practice, simple skills, routinary, non-complex tasks, anything that is only ADLs. Okay? So this seems to be a very easy question, everyone. We'll find out, if you are getting the right answer. Okay? So what do you think is the answer in this situation? Okay? A, B, C, D, or E, and F. What do you think? All right? What's going to be the answer? Okay? Okay, we're about to reveal the answers. Everybody put your final answers, everyone. Okay? What will be the answer in this situation? Okay? All right. So let's see. So remember, in this situation, you have the LPN, you have the RN, and you have the UAP. So what are the responsibilities or tasks that you want to delegate to the UAP, everyone? So put your final answers. We're about to reveal the final answers, everyone. Okay? So let's see. Okay? All right. So we're already in June. Can you imagine that, everyone? We're already almost in the middle of the year. It's 2021. Time flew so fast. Okay? And I think by June 15, we're all going back to our normal activities here in California. So hopefully the pandemic is going to end soon and we're all going back to our normal lives. Although we all know that in other states, or let's say in other parts of the world, we still have challenges with COVID. Okay? So we're taking it slow. So the answer, everybody, is going to be letter A and D. Okay, very good. So A and D is the answer, everyone. Okay, why is it letter A? Remember, raising the side rails is within the scope of practice of the UAP. Turning the client every 2 hours is also within the scope of practice. Okay, so remember that, especially turning the patient every 2 hours. Okay, now you can put your rationale if you want. Okay, now your letter B, removing the indwelling catheter, that is for the licensed nurse or LPN. Maybe in other states, it's allowed for any UAP. However, generally, removing the indwelling catheter requires a licensed nurse, okay? Because it's a complex procedure, especially if it's an indwelling Foley catheter. You have to deflate the balloon, and even do assessment even after you remove the indwelling catheter. So letter B, that's for a licensed nurse. That could be for the LPN. Now, letter C, digital fecal disimpaction. That would be for the LPN or RN. Okay, so that's for a licensed nurse. Now, letter E, checking the skin on the sacral area every shift. Okay, that would be checking the skin is an assessment. That should be for at least for the LPN, okay, or the RN. That is for a licensed nurse because it's an assessment. However, your UAP can report any skin changes. Of course, the UAP can report any skin changes. All right. Now, letter F, adjustment of the oxygen flow rate is going to be for the licensed nurse or LPN, or it could be the RN, of course. Okay, so put your scores, everybody. Let's see if you got the perfect score for tonight. Okay, all right. So we have Vibrant. She said, or Dayan said, she got 3/4 tonight. Okay, congratulations. That's not bad. Okay, so hopefully you learned something tonight. Okay. Anyway, all right. So I would just like to plug in our program, your online NCLEX review. So we do have live webinars, as I've said, every Saturday, and we also have the self-study review program online as well. And it comes with a workbook, and also you have quizzes after the topics. The topics are organized in a very um, coordinated way, so it's like nursing curriculum. So it's a great arrangement of topics. And at the same time, you can comment on the videos. I do the lecture videos in this online NCLEX Review Academy. Okay. So also, we have all the videos of the Facebook Live in the online NCLEX Academy as well. So try to visit our website to check out our self-study program and also our live webinars, everyone. Okay. All right. So thank you very much for those who are making comments, especially with the workbook. Okay. And this is how the workbook looks like, everyone. This is the workbook. Okay. It's 400 pages. Very nice workbook. Okay. So you will receive them in the mail or receive it in the mail if you enroll online. Okay. And then, of course, if you email me, if you send an email anytime, I do respond immediately as well. Okay, so of course, I am available for any emails from the students. Okay, so also we have our merchandise product as well. So if you want to be positive the whole time reviewing for your NCLEX, you can have this as a reminder. Okay, always remember that you can do it in passing your NCLEX. Visit our merchandise store and you can get all the products that you need, especially if you want to support our program and be part of the Matus tribe. Okay, all right. So I think we have a very nice announcement here from one of your classmates. So Akudo says she passed her NCLEX on the first attempt. Okay, and my review on delegation prioritization really helped. So thank you very much, Akudo, for your comment. If you can please make a Facebook recommendation also or Facebook review, I will appreciate that. Thank you very much for saying that my review program has helped in your passing your NCLEX. Okay. And of course, Menchi says that she got 4/4. Congratulations for tonight. Okay. Congratulations. Okay. And then also Noel Burgos is also 4/4 for tonight. Okay. And Maya Sarmiento says that she's learning a lot for tonight as well. Okay. Diane says that she likes how the topics are categorized in the NCLEX online NCLEX Academy. Okay. Very good. So thank you very much, everyone. Okay, before anything else, I would just like to acknowledge our winner next last week. Nell Roma is our winner for the 90-day online access NCLEX review. Okay, so let's give her a congratulations, everyone. Okay, and of course, before we end for tonight, I would just like to thank everybody for your support, of our program, and hopefully as well, I wish that our program is helping you. And let us know if there's anything that we can do to improve the program, everyone. Okay. So thank you very much, everybody. I will see you next week. Okay. And hopefully you learned something for tonight. And thank you very much for all of your comments. If you have any questions, you can put them in the comment section and I will answer them. Thank you very much, everyone, and have a great night.